to tell you openly that there are long-term and short-term health consequences of famine. The threat of famine is looming large, and we need to be mindful that there are short and long-term health consequences of famine. We can always do to prevent excess deaths and diseases if we take early actions. What I also want to say and emphasize that eventually people will die of diseases before they die of hunger. It's important that we take care of the health of these vulnerable populations, especially our children and women. What WHO is doing is to make sure that access to essential health services are guaranteed and ensured, even at the community level. What we do is to make sure that integrated health and nutrition services are accessible and available at the community level, and we are delivering these services through community outreach services and activities.
Thanks to the colleagues of WHO, other UN agencies and the welcoming of the authorities in Jubaland and Kismayo, we have been able to directly observe by ourselves the impact and the consequences of the current drought. It's very often said that the drought is unprecedented and the consequences equally unprecedented. But when you see it with your own eyes, the level of desperation of the people reaching IDP sites in search of any type of help that can be provided for them is really touching. The situation is very severe, is very dire, and it's only likely to get worse. What we have also tried to do during this visit is to understand better what are the most critical gaps and what is the most necessary way forward in terms of their response. We understand that we need the best of all of us and a collective response that brings the capacities of food, nutrition, health and WASH partners to deliver the type of response that will save the lives of thousands of this population immediately. That's the type of response that we need now, and that's the type of response that we are aiming to support.
SIDA is a happy donor to a big part of the humanitarian response here in Somalia. The situation right now is really, really bad, and we're facing the potential of starvation in parts of the country. So it's really important to scale up and scale up sufficiently, not only to reach a high number of people, but also to make sure that we can reach them with quality aid. And to be honest, there are challenges to do so. The money is coming in, but we also need to make sure that the agencies working together can do it in a good fashion to be able to overcome the challenges, work together and meet the needs of the most vulnerable.
We are thankful to our donors who are supporting us to scale up our operations during these severe humanitarian crisis situations. We'd also like to appeal to all our donors to support WHO to make sure that we reach out to all our vulnerable communities with essential health services. This is the only way we can prevent excess deaths and diseases which are largely avoidable, which are largely preventable.